Today, we have with us Dr. Charles Yan, who is the Residency Program Director of University of Toronto. And he is overseeing one of the, if not the largest residency program in Canada.
How do we select candidates that are suitable for a program and for radiology in general? And it's not only for a program, it's a social responsibility too, right? Because these are eventually become the radiologists who want to treat you and me and our families.
Are there any misconceptions that medical students have before they get into residency, or some of the challenges the residents face earlier on?
I think the first thing for the medical students is to decide whether radiology is a good fit for them.
You see a lot of residents, and University of Toronto has an amazing medical student program, and we have medical students in Canada. And you've seen so many medical students interviewing for the program and then getting in. So because you've seen this transition a lot, what kind of medical students do you think should apply for radiology?
That's a very good question and important question, I would say. And
also, like, how can medical students themselves make sure that radiology is a good fit for them?
That's exactly right. I think the first thing for the medical students is to decide whether radiology is a good fit for them. Because I don't want people entering the field and to not be happy with what they're doing, right? Because you can only be good at something you like, right? So I would recommend the students to talk to the radiologists and the radiology residents that can. They meet during their clinical years, find out what they do on a daily life, and there are a lot of interesting topics in radiology that will stimulate intellectual curiosity for the medical students. But I would also ask the students to look at the bread and butter practice of everyday radiologists to see, to think about whether they can see themselves in those roles. Be it the interesting part of it and be the mundane part of it, so that they make an informed decision of whether they like whether it's specialty or not.
True. I think you're absolutely bang on there, because radiology has kind of two phases. On one side, most medical students don't have as much exposure to radiology as opposed to medicine or surgery or something like that. The amount of exposure is a little bit less. But even when they do have exposure, oftentimes they're just seeing us look at images and interpret them. And it's difficult to assess how exciting it can be. It's like watching somebody else play chess. Chess is amazing if you play it yourself, but if you're watching somebody else, it might feel a bit boring, right?
Yeah.
So I think that these are the problems. But then I think I completely understand your point as well. Some people just get sucked into, oh my God, I want to be an interventional radiologist, I want to do this. But you forget that that's not what you're doing all the time. You're kind of solving day-to-day things, and most of the work is routine, just like any other job, I guess. So yeah, it's a tough balancing act for them.
I would also recommend the students to participate in some electives in radiology to gain more exposure. But I totally agree with what you said. It's difficult to the ways the electives are designed right now, just being an observer at the back, looking at the radiologists do their job, is not the same as when you're actually engaged and proactively engaged by yourself.
Yes,
so it's difficult to judge by that. Also, do research a bit on your own. Not necessarily like a scientific research. What I mean more is by looking to what the trends in radiology is. What the future of radiology holds. And just learn more about the different subspecialties in radiology, and what are the big factors that are going to bring big changes to the field in the future, right? For example, AI. For example, the aging workforce, right? The changing government policies. Right. All these will be shaping our specialty in the future, and not just our specialty, for the matter, for every specialty in medicine, right?
Pretty much, like, not even medicine. It's kind of like pervasive throughout, right? Yeah. So, it's a great advice. Like, I think that they need to know more about radiology before they step foot in it. However, many of us, me included, had no idea what radiology was at all. just completely lucked into it, and yeah, it's the best thing that has ever happened. So some of us do luck into it, but I think that the wise thing to do is to look into it, speak to a lot of people, see what life is about, and then kind of make an informed decision. On the other end, when you are interviewing all of these medical students who come in, what are you specifically looking for?
I think that's thank you for that question, because this is one of the first thing I've been thinking when becoming the program director is how do we select candidates
Yes.
that are suitable for a program and for radiology in general. And it's not only for a program, it's a social responsibility too, right? Because these are eventually become the radiologists who want to treat you and me and our families.
Absolutely.
Right?
Yep.
So, so I think professionalism and integrity is foremost for me. And it's not just the words. They have to be good people.
That embody it.
Honest people, good people, and people who are caring, right? Who have good physicianship, who knows that everything they do will have an impact on people's lives, right? And not only on patients' lives, but also on the workflow of the hospital and on the work of other physicians and healthcare allied professionals, right? So that brings me to collegiality. So radiology is becoming more and more a group practice.
Yes.
The days of the solo radiologist is a bit past, right? So and you have to be able to work with radiologist colleagues and also other physicians, because we're in the business of helping the other physicians too, right? So I think in that sense, collegiality and especially communication skills are key to become a good radiology resident and eventually radiologist as well. And I have to say, I don't emphasize too much on radiology knowledge when selecting candidates, because you're coming to our residency to learn radiology.
Yes.
Right. So what I find is that there's a correlation between the clinical knowledge and skills of medical students and their performance in our residency program.
Okay.
Yeah. The good medical students in their clinical rotations turn out to be good radiology residents. And in fact, I think to be a good radiology resident, you need to be strong clinically as well, to know the ramifications, indications, and everything, management for the patient, and what role you play in this whole chain of in the medical system to help the patient.
Yeah. Oh, that's amazing advice. That's a very different way to look at it. I think that the intuitive way all medical students would look at it is that, hey, I'm now interested in radiology. Let me learn something about radiology because that's what I'm interested in. But ideally, as you point out, what you should be doing is that if you make the decision that you are interested in radiology, leave alone radiology, learn everything else, all the clinical features, manifestations, everything. Because once you get into radiology residency, we'll teach you all there is to know about radiology. All of that can be done in a second, but you need to know all of the other things to be a good radiologist. And one of my mentors always says that the best radiologist is the one who is the best clinician. You don't really need to have radiology skills at all. You can just be an amazing clinician and be a really, really good radiologist.
I completely agree with that. And I heard about the same things before.
Yeah.
Yes. Yeah.
So once they get into residency program, can you kind of describe more about how the residency is structured in the University of Toronto?
Yeah, sure. So, for example, I can start from the day they enter and the day they graduate. So, so when they enter as a PGY1 radiology resident, they actually do almost 1 year of off-service rotations, which is also mandated by the Royal College of Canada.
Okay.
But despite that, they still have about 4 blocks, so approximately 4 months that they spend in radiology in the first year.
Okay.
Yeah.
Okay.
So they do about 9 blocks of off-service rotations, and then 4 blocks in radiology. Okay. And those 4 blocks are in what we call the foundational, core rotations. So abdominal imaging, chest imaging, MSK, and neuro. So that's what they do in the first year. Yeah. And every residents entering are assigned a base hospital, because we're a big program. We have many academic sites.
So is it like 3 main hospitals?
Yeah, the 3 main academic sites. So
UHN, Sunnybrook, and St. Mike's.
That's right, exactly. Yeah, and they stay there for their duration of PGY1 and PGY2 years.
Okay.
Yeah. So in their PGY2 years, they're fully into radiology, and even during their PGY1 years, they already started shadowing the senior residents when they are doing on call, so that they learn. They have a transition to get them ready to being on call in PGY2.
Okay, so you have like a gradual transition instead of pushing them into the deep end one day.
Yeah, we don't push them into the water.
That's amazing.
Yeah. In addition, they have a spring lecture series at the end of their PGY1 year.
Okay.
Which is taught by the senior residents.
Okay.
Yeah, to prepare them for being on call as well. Yeah.
Oh, that is incredible. That is not only useful for the junior residents, it also is an excellent practice for the senior residents, because the best radiologist has to be a best teacher. You teach and then you kind of learn by that.
That's right. Amazing. You learn the most when you teach, right? Absolutely. So, so exactly. So, and their shadow calls are structured such that, initially they take more of the observer role, but near the end of their shadow calls, they are more and more pushed towards the main role at their call. And then starting PGY2, they start call by themselves.
Yeah. Call, I think, is one of the most crucial components of residency, because it gives you a sense of independence in how you want to do, how you would manage it. Because otherwise, you're always with the staff, you can always get his opinion. But here, you kind of feel like you have your training wheels off for a little bit. And that actually activates you in the right path. You realize the stakes, you put in the effort, and it's so gratifying also to have that, as you point out, the immediate gratification of calling something appendicitis, and then, MH physician calling the surgeon, they go operate on it, and it's appendicitis. So it's so much gratifying. It's one of the best things that the residents can do. That's one of the best ways to kind of learn during residency as well.
Yes, I agree. Yeah. It is so motivating, and because you're actually making a difference
in people's lives.
Yeah, exactly.
Absolutely. Yeah. And then
so in PGY2, they start call, which is one of the biggest challenges for the new residents. And they also rotate through the core rotations I talked to you about. But in addition to that, they would do ultrasound. They learn their ultrasound scanning skills in PGY2 with 2 back-to-back ultrasound scanning rotations. And then in addition to these rotations, they will get opportunities to do some more subspecialty rotations, which also helps them to explore their interest in subspecialty as well. So for example, nuclear medicine or breast imaging or vascular interventional radiology just to name a few, which actually continues on, these kind of mix of core rotations and, more subspecialty rotations. They, into PGY3, they continue to do that. But in PGY3, they switch from their base hospital, base site, to the other 2 sites.
Okay.
So that, the 2 other academic sites they have not worked at, they will have, half a year each. In their PGY3.
Okay. That is interesting.
So by the end of PGY3, all residents would have gone through all academic sites.
Okay.
Yeah.
Perfect.
And in PGY4, they will be going to different sites, no longer have a base hospital, and they will have more choice at electives. They're also participating in the AIRP, the American Institute of Radiology and Pathology.
Okay, that is amazing.
Course, yeah.
So do they go there?
So they can either go there or they can do it virtually. Yeah. Now,
okay.
That's a post-pandemic option. So they do that, and they do. Another important thing is they start doing their community rotations.
Yes.
In the PGY4, which is a core rotation as well, and I think that's actually very important, and it's mandated by the Royal College, and I think it's very important for the training of the residents.
Yeah, I think that there's quite a difference, right? Like in academic hospitals, as we're pointing out, we have all these subspecialties, and you find that individually the subspecialties are quite different than each other. The skill is not easily transferable, as in if you're a really good nuclear medicine physician, you're not going to be a really good breast radiologist because these are completely two different kind of skills. So now you have to decide which one you want to go to, or you go to the community and then you decide that I want to be a Swiss Army knife. I want to have a bit of skills in everything and want to be able to do everything. So that's something which I did not realize coming into radiology, because when I stepped into radiology, I thought radiology is just radiology. Looking at scans, it's just one skill. But then you find that there is quite a huge variation, and depending on what you like, where your interests are, what you're passionate about, you can choose to do some and not choose to do some. And that ability to pick and choose, I think, is one of the brilliant aspects of radiology.
Yeah, exactly. It's just so flexible as a specialty. Yeah.
Yeah.
So and the same line of thought. So this community rotation will actually open, expose the residents to what a different type of practice is in community, and also prepare them, for their PGY5, because if there are some certain skills they think they're missing, then they can plan ahead and try to schedule that into their PGY5 electives so that they can catch up on that before they graduate.
Okay.
And PGY5, as you know, is their year to prepare for Royal College. And also their year to finish all the remaining requirements that they're missing for their training, all the credits that they haven't obtained in their previous 4 years, and all the more advanced rotations as well. For example, the body MRI rotations at Princess Margaret Hospital, for example.
Yeah.
That's usually reserved for senior residents.
It's one of the most complex things that we do, because I'm an abdominal radiologist. It's one of the most complex things we do. And even after being a staff for so many years, you find always complex cases. So I see that you kind of need to go through your entire training to be prepared for that level of complexity.
Yeah, definitely. And then they also have the options of having research elective rotations, so that they can work on their research project. And
is there an expectation to do one research project
yes,
per resident?
There is an expectation to do at least one research project in the training, and it's not only our program; it's actually a Royal College requirement as well. So. Yeah, so they have to complete that by the end of by the time they graduate. Yes.
Okay.
Yeah. So, so these are more like the chronological kind of things that the residents do.
Okay.
But they do much more than that, right? Because they in addition to the rotations, residents participate in a lot of things. They participate in the teaching of medical students.
Okay.
And junior residents, as we talked about. They participate in mentorship programs. So, for example, we just started a vertical mentorship program where, we are forming groups where there's one resident from each year in that group. So PGY 1 to 5, and we're recruiting faculty members to lead these groups as well. So one of the reasons, because we're such a big program that it's kind of intimidating for junior residents to enter and not know who to talk to, and like smaller programs where you have more social gatherings and things like that. So we wanted to make this more systematic, this mentorship, so that you're assigned a mentorship group right away. As you enter, you can ask all the questions you want, and there are people from different levels of training and even career path to help advise you. So that's also what they do in their residency, right? So. Another thing is we have a very active participation in the governing of our residency program at the residency program committee level.
Okay.
So we have different subcommittees in the RPC. We have education subcommittee that reviews the academic half-day curriculums for the residents. And also is spearheading the creation of a new AI curriculum, a redesigned AI curriculum for the residents as well.
Okay, so you're teaching AI as well.
Yeah, so we're designing that, right? We haven't implemented that yet, but we're designing that.
Okay.
And
so you're making sure that residents are future ready, because I mean, we talk a lot about AI. In bits and pieces, we are kind of trying to incorporate some element of AI, but it's still not mainstay. But in future, that's kind of what's expected. So it's great that you can, ahead of time, making sure that they are ready for the transition that is about to come.
Yeah. So that's one of our goals, right? So, and there's also what we talk about. We have a mentorship subcommittee that oversees and organizes the mentorship programs, the vertical mentorship program we talked about. But there's also even before that, there was what we call a REM program that's matching PGY2 residents to a faculty to help with their transition year, right? So, we have a social and wellness committee that organizes social activities and wellness events for our residents as well. Creating a bit of more cohesiveness about our resident body, but also at the same time trying to address issues to prevent resident burnout. And we have a EDI committee as well that oversees the EDI aspect of residency. And that committee has advised us on improving our selection criteria, for example, and also trying to advocate for certain areas of EDI, and also trying to meet the accreditation requirement of the Royal College at the same time, right? So, so all these subcommittees are resident led. So we have and we've seen a lot of initiatives from residents, and I think it's been a great experience with that, and I really welcome residents to participate, in these leadership skills, leadership positions, to develop their leadership skills. So they participate in research,
and research as well, right? All of them are doing it. So essentially, when they come into residency, they are taught radiology. They are taught all the specialties of radiology, as well as community radiology as to what life is. They are taught AI in preparation for future, or whatever the future things may come in. They're taught that earlier. But not just that, they then are encouraged and expected to do research. They are encouraged and expected to do teaching, as senior residents are teaching the junior residents for call. They're encouraged and expected to do mentorship with all these mentorship programs you're talking about, in which one person from each year, which means that they act both as the mentor of the one's junior and the mentee of the one's senior. So they understand how a mentor-mentee relationship works.
Yeah, that's right.
And not just that, they still get involved in admin in all of these committees. They still get involved in all these academic activities and conferences. And all of these committees are resident-led, that they get involved in leadership. So you're not just training radiology, you're just training very well-rounded radiologists who are excellent in all the facets of their life, not just in radiology, but as to how to be a good clinician, how to be a good person, how to be a good colleague, as well as wellness, and making them more social individuals, because often that's the stereotype of radiologists, that they sit in a corner, watch the screens. But it's amazing that the program itself is structured in such a way that it encourages all of it. So, hats off for running such an amazing program for all the residents. That's amazing to hear.
Thank you.
But in terms of residency program, are there any misconceptions that medical students have before they get into residency, or some of the challenges the residents face earlier on?
Misconceptions, I don't know too much. I think so. One thing is that, well, at least the residents I talk to, most of the residents I talk to, they have a good idea of radiology before they apply. So, which is good, because that's what I would encourage them to find out about what radiology is really like before embarking on this journey. I guess it's more for medical students who don't really know radiology that much. They may, as you said, have a misconception that all day the radiologist sits in a dark room and reports studies and nobody knows where they are. And I mean, it's partly true, I guess, right? So, but of course, the radiologists interact greatly with other people during their work days, with the other radiologists, with the referring physicians who have questions, need help, with patients, before doing procedures, after doing procedures, during procedures, ultrasound scanning and all that, right? So
sometimes the phone is ringing nonstop.
Yeah, exactly.
You wish you were sitting by yourself without any distraction and reading scans all day.
Yeah, that exactly, right? So, and with all the healthcare professionals, the technologists, the nurses, I think, once they see what a radiologist does, they know that, okay, that's not true. The radiologists talk to people all the time, right? So, and to the other part that you asked about, what kind of challenges they have when they enter radiology residency. I think some people are not. Most residents know that they have to study. There's a big transition, from a medical student to a radiology resident, because unlike some other specialties, for example, internal medicine or surgical specialty, which you actually learn quite a lot during your medical school. And like you said, we don't learn that much about radiology in medical school, right? So they don't have that much knowledge about radiology.
The language is different. The jargon is different. Everything is different. You learn new words which you have never learned before. Stranding. What the hell is it? You've never heard this before. And hypodense and hypointense and all this stuff. So it's like learning an entire new language from scratch. So there's kind of a learning curve in the beginning.
Yeah, exactly. So it's quite a steep learning curve, this transition. And for some who are not well prepared or caught off guard, it can be quite challenging. In that year, for example, the PGY1 to PGY2 years. And also it's also a year where you start to adapt your because when in PGY one year, you're still doing a lot of off-service rotations, which you're familiar with because from the medical school experience, right? But when you're fully a radiology resident in PGY2, you're trying to adapt to that role and becoming comfortable being a radiology resident. And sometimes that can also lead to challenges and even burnout, I would say, because it's such a steep transition. And I've seen that happen in some residents, and it is challenging. I know.
It's very interesting that at different stages of life we get said the exact same thing. So when I was in school, and before I got into med school, they were like, no, you need to give it all your effort, and then once you get into med school, everything is smooth sailing from there. You get into med school, I'm like, no, okay, whatever you did now doesn't matter. You need to learn so much to get into residency, and then everything is smooth sailing from there. But what you're saying is that even when they become residents, the learning curve is so steep that their life starts there, that there's so much effort and hard work which needs to go along with their interest and passion for them to kind of able to transition through all these roles and come out as like an amazing radiologist at the end.
Yeah, exactly. And I would say, not just radiology, just the transition from medical school to residency itself is a big transition.
Yeah.
Because there's a change of role, from being a medical student to a resident.
Yeah.
So, yeah.
You're no longer just a medical student now. Yeah. You're a resident. You better...
you're a doctor.
Rise up to all the... Exactly. Yeah. You're a doctor now. You rise up to all the responsibilities that kind of come with it, right? Yeah. What else? Yeah. What are the other challenges which the residents are facing these days?
Yeah, I think one thing is that the residents are having less autonomy in their training. And which is actually impacting their motivation as well, I think.
Yes, absolutely.
So that's one thing. I talk to people, and I think a lot of people know that as well. The medical system is placing more and more demands on our specialty as a whole, requesting that we provide fast turnaround reports, provide 24/7 coverage as staff radiologists, which I understand because the medical care is trending towards more and more an evidence-based practice, and radiology being one of the forefront of that. And this trend has also helped patient care in that sense. But it's actually creating a strain on residency training radiology because everything because of the time. Turnaround time and also the coverage, staff radiologists tend to take things on their own, because they need to meet that requirement.
Absolutely,
right?
Yeah. That gives less opportunity for residents to participate.
Yeah, and they still participate, but they don't feel that they participate in a meaningful way, if you understand what I mean. If they issue a preliminary report that's going to be replaced by a final report in a few minutes, the sense that we had as a resident when we were on call by ourselves
Yes.
with no staff present, and then our report will change the course of the patient
Yes,
overnight.
yes. So the stakes are higher. You feel more involved or more responsible.
Right, and if you make a mistake, you're going to remember that because it actually changes the patient's life.
Yeah.
Right. So, and it motivates you to read about it too.
Absolutely. Yeah.
Right. But now, we can tell the residents, even despite the system, you should try to feel motivated. It's easier said than done, right? So
Yes, as long as you don't have skin in the game, you're not going to feel that same amount of motivation, I guess. So yeah, I guess your advice to all the radiologists and the systems is to allow residents a bit of autonomy, allow them to make these little mistakes so that they can kind of learn better, rather than trying to make things very easy for them by not letting them do anything, by not letting them do stuff. We're actually taking away the opportunity for them to be involved, motivated, and come out as great radiologists.
Exactly. Yeah. So that's what I would like to tell all the radiologists and rotation supervisors is that let the residents do things, but supervise them. Right. So you'll be surprised that how a lot of the residents are really they want to do it if you give them the opportunity. Right. So
they just want an opportunity to kind of show that. That's amazing. And before we end, what's one word of advice you have for the residents as well as all the medical students who are aspiring to be residents?
Well, I would say whichever stage of training you are at being a medical student or a resident, always have the end goal in mind, is that you want to become an independent practicing physician. So whenever facing some situation, don't just put yourself in the shoes of a learner. Think about what you would do if you were the doctor and the only doctor.
Yeah.
Right. And then once you have that solution in your mind, go talk to your supervisor and discuss whether that's appropriate or not. Right.
That's an amazing advice. I mean, the way you put it, that put yourselves in the shoes of not just the doctor, but let's say that you're the only doctor available. What would you do? And let's say that that patient was somebody who you knew dearly. What would you hope somebody else had done? And always putting yourselves in both shoes, even when you're kind of in the training process, would, as you point out rightly, would help create amazing radiologists down the line, who hopefully when we are old and our kids are old, they're going to be able to take care of us. So thank you very much, Charles, for heading the residency program here, the largest in Canada, and for doing an amazing job. And hopefully you implement more into the residency training, and we kind of get amazing residents because of you. Thank you. It's been a pleasure.
Thank you for having me, Satish.